Let's have a closer look at the latest coronavirus figures now with our ABC analyst, Casey Briggs. Good afternoon, Casey. So what do you make of today's figures from Victoria then? 439 new cases, sadly 11 deaths.
That's right. We'll start with the cases, which are broadly flat on yesterday. And so we're seeing 439, just up from 429 the day before. What that means is we're sort of the 7-day average, the weekly trend is sort of increased a little bit today, but not a whole lot. So that's at least one nice thing to see. I don't think we'll see the numbers start to come down in any dramatic sense for at least a few more days until we see the effect of stage 4 restrictions. And when we do start to see those, we'll be watching very closely at the number of infections with an unknown source. These are the case investigations that have been closed without a source of infection being found, and there are 128 more of them today. This does lag the new case information, so it'll be a little bit longer before we see a drop in that. But we want to see these numbers come down from the record levels they're at the moment, because that gives us some comfort that chains of transmission through the community that we don't know, that we can't trace and we can't track and we don't know about, are going down, and so more clusters won't start up again. And so this is a really key number to watch in the next couple of weeks as we go through. As you mentioned, we have seen another 11 deaths. I'll show you the chart of deaths in Australia, 232 now in total, and we've had a few shockingly bad days in the last few days. 11 today, all of them linked to aged care. That remains where we're seeing most, something like 2/3 of Australia's overall deaths to date have been linked to aged care homes. And because we're still seeing more and more aged care residents being infected, this hasn't been updated today. We haven't got an update, but 39 infections yesterday, 64, 67, and that's just among residents of nursing homes. We're still seeing them being infected in high numbers. We're still seeing clusters growing there, and they need to be brought under control.
And what's happening elsewhere in Australia, Casey?
Well, we've had updates from all 4 states now that are dealing with local transmission, including Victoria, of course. We'll start with New South Wales, 12 new cases, but when you just look at the locally acquired cases, it's actually 8. One of those 12 is a case that was acquired overseas. It is someone in hotel quarantine. 3 of them are cases we actually first heard about yesterday, a family in Wagga Wagga that have acquired it interstate. And so for the purposes of cases just acquired in New South Wales, we're looking at 8 today. That hasn't updated. And what that means is we've seen for a few days now numbers trending sort of downwards on this chart, and that's a really nice thing to see. It shows that the contact tracing in New South Wales has been really very successful to date, at least so far. And if we keep seeing numbers like 8 and 9 for the next few days, we'll start to see that trend line come down again. So there is a little bit of a reason to be optimistic in New South Wales and Sydney at the moment. These numbers, not only are they not getting worse, they're starting to slowly improve. We want to see that continue for a little bit longer. We're also seeing 2 cases today in South Australia. That's a slightly worrying situation. The numbers are still small. One of them's linked to that known cluster that we first learned about a couple of days ago. So there's 4 cases in that cluster now. The other one might be community transmission. It's under investigation. Authorities don't know where that person has been infected, and SA Health have now issued a public health alert over a series of venues that are potentially exposure sites, as we've now seen done in 3 other states. So South Australia, one to watch. Queensland, still good news. 0 cases today, 0 cases yesterday. Queensland health authorities want to see zeros for about another 6 days before they can be confident that the cluster they're dealing with there is under control.
How are things looking overseas then, Casey?
Yeah, but let's just take a quick look overseas. We've got 18.2 million. The United States is still, of course, by far the worst hit nation with more than a quarter of those. But it's worth remembering, of course, it's hard to compare these numbers sometimes because not all states and all countries are reporting these figures in the same way. Not all of them have the same capacity for testing. And in some cases, it seems like some governments may be withholding information or not reporting full information in the fullness of time. I just want to show you one country, and that is Iran, because the BBC have just reported on an investigation they've been doing into the Iranian case numbers. They're officially recording 2,500 cases a day. It's the worst outbreak in the Middle East. But the BBC's found some documents that seem to suggest that the death toll and the case counts in Iran are quite a bit higher than these numbers would suggest. Not 17,000, more like 40-something thousand, all the way up here on the list. So it's just worth remembering when you're looking at these global tallies and comparing countries, that sometimes it's a bit hard to do so, and you can't always take these numbers completely on face value.
Casey, thank you.